Yes, sir.
It's usually not palpable, right? But here it's palpable. बस बस अब मत सकते सूख सकते हो yeah right. Tell us about this case.
Yes, sir. So she is a 28 years lady who was a case of primary hyperparathyroidism who came to us with complaints of bony pains in the pelvis. So her serum calcium was done, which came out to be more than 14, and her PTS levels were also more than 900. With endocrinology review, she received zoledronate, and now she is with us for parathyroidectomy. Before that, sir, we also got localization study done in the form of system AV scan, which showed that the left superior parathyroid which is in the location of which is intrathyroid in location, which is functional, sir.
Now this question I'll ask you now. What difference does it make to our management?
So now,
About the system AV scan.
since it is intrathyroid in position, we will have to maybe do the left hemithyroidectomy as well.
Right or left?
Left, sir.
So we may have to do a left hemithyroidectomy to get it out. That's what you're saying. But we'll find out. Superior you would find very close to the
Posterior surface.
inferior you find more commonly. Superior is rare. All these adenomas that you've seen here with size, majority are
Inferior.
inferior. If it is superior, it will look like it is in the thyroid substance, but it may not be. So don't come out with a blunt statement. It will totally depend on what do we find. What is the significance of a palpable parathyroid?
So palpable parathyroid is most likely suggestive of it could be carcinoma. And
What else? What else would you find?
Otherwise, thyroid is only palpable. So parathyroid.
Parathyroid is not palpable usually, but if parathyroid is palpable, then the chances are you're dealing with a malignant one. And also looking at lymph nodes you should look for. There should be one more investigation which you should have done. Must have done.
high
Maybe
resolution
ultrasound.
ultrasound.
Which is already done. So system maybe scan is to localize, but ultrasound is to localize before surgery. Always a good idea. If there is an adenoma and if it is superior parathyroid, I will find superior parathyroid. What are the ways to localize it peroperatively?
Besides, we can do intraoperative ultrasound. We can
Yes,
use
intraoperative ultrasound and ICG. You don't think of what you don't have, no? But now you have it, so we are doing it. So the other method is methylene blue. Injecting methylene blue, but that's his thesis. Sentinel node biopsy. He found that parathyroid also stains up. But let it be messy. ICG is a very good idea. With ICG you can pick up parathyroid very quickly. But you can confuse it with lymph nodes. So you need to be careful. Localization is what we look for. These are options. Bolo? You have a doubt. Superior is rare.
He said actually my doubt was the parathyroid is never the intrathyroid, sir, because the development is different.
No, that's what I'm saying. When they write intrathyroid radiologically,
It
it is always extracapsular. No? So parathyroid would be lying separate. Whether they feel it intrathyroid or not is basically no. You may get intrathyroid parathyroids. Therefore, if you have not found all four parathyroids, you must mention in the report. Pathologists may report a parathyroid inside. So they are found, but very rarely, not common. They develop totally differently from parafollicular cells, which can lie on the posterior surface of the gland. But a gland can grow beyond it sometimes, so you may very rarely find intrathyroidal parathyroid. Otherwise, mostly parathyroid is outside. And even this would be outside, I'm telling you. When it enlarges, it may feel like, or on ultrasound, they may give that kind of look. Even after surgery, when we send a specimen, adenoma, is there any reporting that they do? They don't mention that.
They just write parathyroid.
They just parathyroid tissue, and then do you link it to what is that criteria?
Milan criteria.
Sir, actually,
So Milan criteria is used after resection of the parathyroid gland to check if it's adequate resection 20 minutes after the gland removal. Blood samples are sent via cold chain to get the IPTH values. it should fall more than 50% of the preoperative value. That indicates adequate
So
resection.
it is not based on any frozen section or any histopathology. They find that if the parathyroid levels dropped, then it was parathyroid that you removed.